Our funny eggplant is becoming famous these days. Well, it was just about eggplants. Some foods are not given to babies in the first years, and one of them is this eggplant. And the reason being, the eggplant has a little tiny bit amount of nicotine, which we don't want our babies to get in the first year of life. So we should be careful about. The other one is the fava beans. Fava beans may cause an acute anemia in children with jaundice if given to children, to those who lack a certain enzyme. So to be on the safe side, we don't offer children less than 2 years of age fava beans. And the other one is the famous honey, which we don't give in the first year of life because of the scare of botulinism toxin being in the honey, which we wouldn't know. Another group of foods that cause local irritation, but they get a bad reputation for the local irritation and thinking that they're causing allergies, is tomatoes and spinach. In especially fair-skinned children, when they touch their skin around their mouth, these may cause some irritation on the skin. So if that irritation goes away quickly, don't think it's allergies to either of these. Then I hate to call food bad, or I hate to call any kind of food unsafe for children, but these are the group of foods that we should be very careful about when they are around children. And we should try to find forms of these vegetables or fruits or foods that are safer to give to the babies. Of these, what is the common denominator is the possibility of these foods blocking the airways, going the wrong way. Instead of going down the feeding tube, if it goes down the breathing tube, then they may block the actual main breathing tube, or the bronchi, which are the branches of the feeding tube. So the pomegranate or corn can actually block a small airway. So we should be very careful and may give pomegranate juice if we're going to give any pomegranate to our children. And a paste of corn instead of corn itself. Then another group which you may not think of is the fruits that have skins. And an example to this is grapefruit or tangerines or oranges, which when we give to the babies may block because of their skins. So when we're giving, we should be giving bits of these, and if they have thick skin, we should better take off the skin before giving it to the baby. Then when it comes to the seedy fruits and vegetables with small seeds like the olive, the better way of giving this olive to the baby is taking out the seed and giving it in small bits. And we do give a lot of cold fruits and some hard vegetables to the babies when they're teething. Especially cucumber is one of them, and apple slices and pear slices are another example. The problem with these is, even if your baby has no teeth, your baby can cut this quickly and easily in big bits and may block his or her airway and cause choking. And the famous nuts, all kinds of nuts, when they're hard and small like this, like the hazelnut or pine nuts, cashews, any kind of nuts may be aspirated by your child. So the best way of giving any nuts to your baby is giving them crushed and mixing them, for example, with their fruit purees. Another dangerous food that may block the airway, which you may not think as dangerous, is the pastes, thick pastes. What happens with thick pastes is that if they are taken in chunks, they can cover the throat, and your baby may have difficulty breathing, and swallowing. This may be hard for the baby to handle. So these are a few foods that you should be careful about when you are giving it to your babies and children.